Good afternoon, everyone. My name is Balas Subramaniam Ilango. I did my medical schooling in India, then did postgraduate training also in India, then came to United Kingdom for eye specialist training. I did most of my trainings in the West Midlands and London. Then subsequently I was appointed as a consultant ophthalmologist at Wolverhampton Eye Infirmary. I also work as a medical director for Optimax Clinics, United Kingdom, and also as a responsible officer for the NHS England and the General Medical Council. My role is to do eye clinics, see our patients in the outpatients, which could be involving patients who have gone blind due to corneal disease, eye trauma, infections. So I do corneal transplant surgery and also cataract surgery, and also do refractive surgery in the private sector, such as multifocal lens implant and implantable contact lenses. So in the private sector, mostly patients want to be spectacle or contact lens free, hence they opt for these kind of cosmetic lifestyle treatments. So that's my special interest. Ophthalmology as a specialty, it's quite unique in the sense it's got three different branches, like a medical ophthalmology, surgical ophthalmology, and refractive surgical ophthalmology. So when as a doctor, some people don't like to do surgery, and then they can still come into ophthalmology and become a medical ophthalmologist, mainly treating diabetic eye diseases or the infective or inflammatory eye diseases. Or if somebody is want to be a very good surgeon, with a lot of skills, microsurgical skills in ophthalmology, because we do use microscope and we use 10 nylon sutures. It's all very meticulous surgery. So that way, a surgical person will be fully satisfied too. And the other one is if somebody wants to say, particularly if you look at the current medical health sector in the United Kingdom, the NHS, it is really struggling to cope with the demand, and then the private sector is thriving that way. So, in ophthalmology, there is a lot of private practice involved. So that way you can get into the private sector, especially with refractive surgery, where you can do excimer laser vision correction to help people to be spectacle free. Also, other procedures such as multifocal, trifocal lens implants or implantable contact lenses can be offered to patients to make them have a better lifestyle. So I think the main benefit I find in ophthalmology as a career is it's almost like a 9-to-5 job. You kind of guaranteed to go home after 5 o'clock to your family. And the second benefit is I don't see any deaths. Some specialties, doctors, my colleagues, I got colleagues who work in neurology or oncology. So they see a lot of patients dying in front of them every day on a daily basis. That makes you feel depressed. So you go home, with a heavy heart. So whereas in ophthalmology, I've done nearly 20 years now. I've never seen one of my patients dying. So that's another huge benefit. And the third one is I find it is quite a rewarding job. You got huge job satisfaction. You perform a cataract surgery for a patient, and the next day they're so happy you get back the vision, and they're so thrilled. Equally, again, you do a excimer laser vision correction treatment to a younger person, and it gives them that freedom from spectacles, contact lenses, and give them a better lifestyle to do their contact sports or better lifestyle. So that way, it's quite a rewarding special surgery. The drawbacks, personally, I can't see any drawbacks actually. I work at the NHS as a corneal surgeon, as an ophthalmologist. I do on-calls, emergency work in the NHS sector. Compared to my other colleagues in anaesthetist and cardiologist and accident and emergency doctors, my workload-life balance is much better. I have a better, weekend, time with my family. So I can't really see any drawbacks actually. When it coming to applying for jobs, it's similar to any other specialty. You have to apply, obviously get good grades in the A levels and apply to UCAS, go into medical school, choose which medical school you want to get into. Generally Oxford, Cambridge or London universities are very popular. And because ophthalmology is a smaller specialty, it is competition is a bit high compared to orthopedics or other anesthetist, specialties. Apparently, I was told that there's for every post in ophthalmology there are 7 applicants. So a lot of ophthalmology trainees, what they do is they do a lot of research work before coming into ophthalmology, like do a PhD or do a lot of research or audit projects as a medical student. So that way you got a better CV and you're likely to get selected. So that way, you once you enter to training as a specialist trainee, you're guaranteed to become a consultant ophthalmologist. There is a job end of your training. So it is expanding specialty because the people are living longer. The population, is growing steadily in the United Kingdom. That way, a lot of eye problems are age-related. So you'll never be out of job as an ophthalmologist. So if I'm a medical student now, and if I want to choose my specialty, I would start all over again to be an eye surgeon. I remember when I was a third-year medical student in India. Initially, I was just want to do plastic surgery or cardiothoracic surgery. But as a third-year medical student, I was supposed to into ophthalmology, and I saw this elderly lady having a cataract surgery. Then the next day, she was so happy. She thought the eye doctor was a god sent. She really treated him as somebody supernatural, somebody as a miracle person. So that made me to switch into ophthalmology as my career. I would still do the same even today.